we're here today certainly has nothing to do with the weather. We're here today because we're looking for truth in healthcare. And at least part of that truth is that we've already won victories. We've won victories, significant victories, over the years in defense of what we believe in, our public healthcare system, but we've been winning victories over the last couple of weeks. 6 weeks ago, our Premier and our Health Minister, in response to a growing uproar about wait times, abuse, and intimidation in the healthcare system, they reassured us. They said they were on top of things. They said that everything was in hand and that there was nothing to worry about. That didn't work. When people didn't believe them and didn't take their assurances at face value, they turned to threats. They said that the people who were raising concerns were cranks. They even suggested some people were crazy. But Albertans knew different and they kept pushing. So today, 6 weeks after the Premier and his Health Minister, who some pundits call the velvet fog, I like that, his soft-sounding words descend on us, tried to bamboozle us, but we're not having any of it. 6 weeks later, we don't have our inquiry, but we do have an investigation that's bigger, broader, and will be deeper than the government ever planned for, and that's because of people like you, putting pressure on this government to do what's the right thing, what we know is the right thing. Now, I just want to say a couple of things about the inquiry and the search for the truth, because in many ways, I think everyone who's here today knows that we don't really need an inquiry or an investigation to know the truth about healthcare in Alberta. We don't need an investigation or an inquiry to know what's rotten with governance in this province and especially governance of our healthcare. Because the truth is, the central truth when it comes to public healthcare in Alberta is that the vast majority of Albertans love public health care. And they don't just love it out of sentiment. They love it because they know it works. They love it because they know it's the best thing for the Alberta public and the Canadian public, and they know that it's proven and worth defending. That's the core truth about the healthcare debate in Alberta. But there's a dark flip side to that truth. While the vast majority of Albertans love their healthcare system and are willing to protect it, the dark flip side of that truth is that there are many who don't share our confidence and our attachment and our willingness to fight for our public healthcare system. There are many people who believe that we should privatize, that we should open the doors to the free market. Now, it's bad enough that there are people among us who have those beliefs. What's even worse is that they're right here in this building. They're the ones calling the shots. So that's the truth that we're facing in this debate over a public inquiry. It's the truth that we've been facing for years. So that's the truth that was behind Ralph Pine's action on Bill 37, Bill 11, the Mazankowski report, the so-called third way. It's the same reason that more recently we've been hearing talk about the Stalin government's new approach to privatization. They've learned something. They've learned the central truth that Albertans want their public health care system. So we've fought to maintain our public system, and they've gone underground. They haven't changed their views. They're just resorting to secrecy and intimidation. That's why we're talking about the things that we're talking about right now, because they haven't given up their campaign to subvert and undermine our public health care system. The good news, though, is that Albertans are still unshakable in their support. We fought them on Bill 37, we fought them on Bill 11, we fought them on the third way, we fought them, and even in Conservative Alberta we won. And you know what? We're going to win again. Just to wrap up, I want to say this. Okay, because the battle is ongoing. And just last night I picked up a book that I found was profoundly important in terms of what it reminded me. And it was a biography of a guy named Stephen Harper. Okay, because the problem that we're facing with healthcare is not just an Alberta problem, it's a national problem. And in this book, written by one of his friends, Tom Flanagan, another former reformer, Stephen Harper admitted that his goal was to change the Canadian mind. He recognizes that Albertans love public health care, that they believe in working together, they believe in working as a community and supporting each other. He knows that, but he wants to change it. So that's his long-term project. And now that we're on the doorstep of another federal election, my message to you here in Alberta is to fight at this building, but also don't forget that other forum where we have to fight for our public health care system. The time is now to make a difference at the federal level. Stephen Harper wants to change our minds. I think it's time that we change our minds about Stephen Harper. Okay? So I'm confident. I want you guys to remember the reason we've won in the past, the reason we've got a deeper inquiry than we would have otherwise, is because of our opposition parties, but mostly because of people like you. Coming to events like this, writing letters, making phone calls, you've made a difference, you've turned up the heat, and now we have to turn it up harder. Don't give up, because if you give up, then they will change the Canadian mind and change the things that we believe in, including our healthcare system. Don't let it happen. I know together we'll make that difference. Thank you.